Hello and welcome to the presentation on Irlen syndrome, everything OTs need to know. Terry Carlson, Irlen Diagnostician, and myself, Lucia Lara, Occupational Therapist and Certified Irlen Screener, we're very thankful to have been able to present at the recent WOTA MiniCon in April 2023. We've subsequently been asked to record our presentation for virtual access over the summer. I'm going to go ahead and share my screen. First of all, Terry's going to share about Irlen syndrome as an Irlen diagnostician. Following her presentation, we're going to segue into my presentation, which is the occupational therapy lens on Irlen syndrome. Let's go right ahead, and I'm going to share my screen for our presentation.
Okay, welcome everyone. Thank you, Lucia, for the introduction. My name is Terry Carlson. I'm the Irlen diagnostician here in the state of Washington. I also travel often to Montana, Oregon, Idaho, and Alaska. And there are three words that I often hear from people that I work with: relief, validation, and solutions. Relief, that someone understands what they're going through and what they're experiencing. Validation, that their symptoms do exist. And the solution is what we offer, which is the Irlen Method that diminishes and or eliminates their symptoms and distortions that are interfering with their productivity and their ability to live life to its fullest. And this could be a piece of the puzzle for many of the people that you work with, or it could be the whole solution. Thank you again for watching this and sharing what you learned today. So 3 key takeaways that I'm going to share with you is what Irlen syndrome is, how it affects patients, and how you can determine if a person has this or not, and the solutions to help them. So my years as a diagnostician is 12. I've been a screener for 15. I have 20 plus years in general education, public schools, as a special education literacy specialist. My business is Irlen Services Northwest here in the Northwest. I'm in Seattle. And I want to talk a little bit about the ability versus performance gap, especially for students in the classroom. And this also affects people on the job, because if your performance and ability have such a gap where you are able to, you have the ability to do a task, but when you go to perform actually completing it, there's such a gap that there's something missing. There's symptoms or distortions that are happening that are preventing the even playing field of the ability and the performance to match. And so my background in the classroom is that I had a lot of students that had very high ability, but they couldn't pass a test, or they weren't able to access reading. They were very, very low readers, primarily 3rd grade reading in 7th grade, and were not advancing, no matter the interventions that we tried to use with them. So I tried to find out what the gap was and how we could support them and close that gap. And somebody that had given me overlays that are colored plastic sheets that were to help support people with reading. And I put them down on the page, and lo and behold, people just magically started reading. So it wasn't that these people didn't know how to read, it's that they weren't able to access the information on the page. And from there, they moved up and out of special education and onto greater and better things. So we work with the medical model as far as what is a person experiencing versus a standardized test where we tell them what their score is. And that is how the Irlen Method is set up, is based on the medical model. Okay, so Irlen syndrome is a visual perceptual disorder. When we open our eyes, our brain is flooded with light, and light travels at different speeds. Some are faster and some are slow. So if the receptors in the brain are not perceiving the environment correctly, or the visual processing fields correctly, the timing of the light is coming in at the wrong speed, therefore causing visual distortions and symptoms. So the problem is not with the eye, it's with the brain. Common visual stressors, light sensitivity and glare, stripes and patterns, reading and fine details. And it's pretty much, this is not just a reading issue, this is a total environment issue because we visual process everything within our environment. So this is a sample of a person's handwriting. This is a 9-year-old student, and she was given a white piece of paper to write whatever she wanted to on. And then immediately after, she was given a pink piece of paper to write something on. And these were done one right after the other, the same person. Didn't practice, didn't, spend any other time. And the only difference between these two pieces is the color of the paper. Therefore, the access of the information on the page. So her ability was there, but her performance was not able to take hold because she wasn't able, the page basically was too bright for her. So this visual perception, it impacts the entire body because we've got our computer up here that regulates everything else that's happening in our body. So if there's that, the stimuli in the brain is not perceived properly, people experience symptoms such as headaches and migraines, tension, anxiety, shoulders, stomach, their breathing is very shallow. Their small and gross motor integration is compromised. They experience nausea and fatigue, which are some of the major symptoms, although everybody experiences these in different ways. And what we do is help them identify those, become aware, and then relieve those symptoms that are bothering them. So these are either acquired through head injury or illness, or this can be hereditary from mom, dad, or both parents in some cases. It affects males and females equally and is often misdiagnosed because of the overstimulation of the brain can cause similar symptoms to other conditions such as ADHD, autism, Asperger's, and a myriad of other conditions that affect people. We'll cover that shortly as well. So this has to do with a failure of timing, like I said, with the visual pathways. If the optic nerves are parvo and the magnocells are not reading the wavelengths of light correctly, that's where the distortions and symptoms come in. And a person is not able to practice their way out of these symptoms. We need to, with us, with the Irlen Method, we use color to normalize those symptoms. So recently, back in 2019, we were at the World Congress on Brain Injury, and Helen Irlen presented the Irlen Method there, and a study that she had conducted of 100 at Cornell with 184 participants that were medically resistant to headaches and migraines through conventional methods of medicine. And they also experienced, some of them had experienced TBIs, traumatic brain injuries, and they wore the filters for 4 to 12 weeks with a significant reduction in migraine frequency, and the medication use went way down, and the scores on the HIT were also significantly reduced. So how Irlen syndrome affects patients. So I have a case study here of a young man named Bert. He was at the time 35 years old. This was about 4 or 5 years ago. Microsoft engineer, husband, and father. He was in a rollover car accident and experienced many broken bones and a traumatic brain injury, PTSD. He started self-medicating by isolating himself. His symptoms showed up about a year for light sensitivity, especially about a year after his accident. So this didn't happen right away. He did go through a lot of therapy and treatments to heal all of his broken bones, yet this other issue lingered for him. And what he would do is he would take some tape, some sunglasses, and tape them to his face, and with black electrical tape so that the light wouldn't bother him. He also wore noise canceling headphones because his brain was so overstimulated that sounds also affected him. So this is Bert with his glasses on. And I'm not sure if the video is going to play.
Right.
There we go. I want to share a little video of him. It's a couple minutes long, but it's very interesting to go through his experience with him. So with a person that has Irlen, their world tends to slowly get smaller and smaller because they avoid anything that's going to make them uncomfortable. So this is all the light that he could tolerate. And then we started his Irlen filters, of which his first pair, he had 8 different colors. That's what he wore before the filters. His second pair was 5 different colors. And then he went down to 3 colors. So as he healed, his colors changed and lessened. It went down to 2 colors. You. Okay, so these are all of the treatments that Bert had tried. He tried physical therapy, tried speech therapy. It wasn't approved by insurance, so he learned how to help himself with an online video. Vision therapy made things worse for him because of the light sensitivity. Neurology, only initial testing was approved, so he didn't receive any treatments from that as a result. Neuropsychology to understand light sensitivity, but the exam made it worse. The Amen Clinic, he went there, had the brain scan, found it helpful, but they pretty much determined a specific diet or supplemental regimen for him to follow. Stem cells, the two pieces that did work for Bert to help him heal from his perspective was the stem cell treatments that he had and the Irlen filters. The next case study that I have to share with you is April. This is a hereditary piece. She's 43 years old. She works on the computer for work. Headaches as a child every day and continues to experience them. So she's had them for years and years. Diagnosed with ADHD in her mid-30s, she was still trying to figure out what was going on and searching for something that would help her. She gets to the point where she wants to stop reading. The page is super bright. She loses her place, her focus, and work for her is very uncomfortable. So this is April, and she has a short video to share. I don't know if the sound is going to work. So for April, I'm not sure if you can hear her, but I'll kind of paraphrase for her. She's talking about how these have changed her life. She's holding up a pair of filters to her eyes, and she's talking about how one eye pretty much did not function for her, and I'm not sure why, if that was just an injury from previous, but she didn't share that information with me. But she's talking about when she takes the filters off, her stomach hurts. She feels tension in her head and her eyes and her forehead. And then I asked her to put them back up and talk about how she felt. And she immediately took a deep breath and her system starts relaxing. So this affects the whole central nervous system, and people can actually feel their bodies changing when they put these filters up. Okay. So Irlen syndrome, technically, the brain is unable to process certain wavelengths of light. The brain is allergic to certain kinds of light. So the light's playing tricks on the brain. It's almost like an optical illusion for some people. Bright lights like sunlight, fluorescent lights, even overcast skies can hurt the eyes, give people headaches, stomach aches, makes the words move, makes people feel jittery or anxious. People blink a lot. It's hard to concentrate. A person that I spoke with a couple of days ago, she told me that when she drives and looks down the road swirls and inverts inside of itself. So there's all kinds of visual distortions that people have, and it also affects depth perception. How does this affect people who have it? Well, they tend to get stuck in a certain place at work if they want to advance. A lot of times people take tests online, and they're not able to pass that test, even though they know that information, their supervisors know they know that information. But to take a test on a computer, which you're actually looking into a fluorescent light bulb when you're looking into a computer screen, and people are unable to perform in that capacity, even though they've got the information up here. Have trouble with traditional education because they're in classrooms with fluorescent light bulbs, can't function under those conditions. Sunny days or cloudy days, depending on the person. They wear sunglasses everywhere to make their world dark, because comfort equates with darkness. They're always tired and fatigued, constant headaches, and it affects their overall quality of life. Activities a stressor, pretty much anything you do when you open your eyes, visually intensive activities. It could be needlepoint, it could be TV screens. I had somebody yesterday ask me about watching TV. They can't watch TV. There's too much going on the screen. Things are moving too fast. Their processing isn't able to keep up. Scantron sheets are those little ones you bubble when you take a test. Yeah, it's any visually intensive activity. Problems and misdiagnosis in these areas also affect behavior, attitude, or emotional problems. And some students that I had worked with in school, it wasn't that they had an anger issue, it was more frustration that they couldn't complete the work no matter how hard they tried, and more practice wasn't helping them. So it was more of a frustration issue for them. When we could give them a simple tool to access the information, then they could show what they know. ADHD presents similar to Irlen syndrome, as in the brain's overactivity and overstimulus. Physical symptoms: stomach aches, headaches, migraines, small motor, gross motor integration, depth perception. Coordination and balance is big, because if the depth perception is thrown off, their coordination and balance are definitely affected, and neurological fragmentation. So this is a mind-body connection. If the environment is affected and visual activities are affected, that goes into perceptual stress, which increases the brain chemistry, the cortisol, the dopamine, the hormones, change in the automatic endocrine immune systems, which take a hit if this is left untreated, because the systems start breaking down over time, which then in turn affects everything that we do in life. And there's like I said, misdiagnosis with these, and problems: sensory integration, depth perception, vulnerability to stress, learning issues, all of those issues. Reading symptoms, reading difficulties, and discomfort. I always tell people, if there's one question they could ask someone who is not reading, the question would be, when you want to stop reading, what does the page look like? Reading difficulties. And how do you feel? Discomfort. So as a teacher, if I looked at reading difficulties, I might say, if a person is having trouble reading, I might give them an extra reading class, or an intervention, a different program, something that will support their reading skill. But if their discomfort is such that they stop because of headaches, migraines, dizziness, they get sleepy, fatigue, they're going to stop because of discomfort before they stop because of reading difficulties, because they don't feel good. So no matter, like I said before, how much they try, how good the intervention is, how good the teacher is, it's not going to matter if they can't access the material where the page is clear and stable and they're comfortable. Then we have an accurate baseline. So 46% of people with learning disabilities and reading problems have Irlen syndrome. ADHD, dyslexia, behavior problems, 33% of those people have Irlen syndrome. 14% of people that are average students, gifted, or good readers can have this. And it's a barrier, but what they do is they learn to cope and compensate and move through it, but it takes a toll. Autism, because of the visual stimulation of their environment, 30% of autistic people can be helped with this Irlen method. Other populations, so we've got the medical populations: light-induced epilepsy, autism, Asperger, depression, TBI, concussion, whiplash, visual and comorbidities, diseases, and impairments. Astigmatism, low vision, and blind. I'm working with a lot of people in the low vision and blind areas right now. Diseases and comorbidities: autoimmune system, CFS, MS, cerebral palsy, Parkinson's. All of those with the overstimulation of the brain can affect these diseases and comorbidities. And if we can get the system calmed down a little bit or a lot, the treatments that for these other conditions take hold better, because it's not fighting against each other. What's the solution? Here we are with the Irlen method. So this is the process. So we self-test and identify the risks. So if a person thinks they have this, we send out our are forms for them to complete, and many of them score yes on every question in the areas such as sports, light sensitivity, visually intensive activities, copying, writing, driving, 14 major areas. And we help them identify what is happening to them. And if they're not quite sure, then they can start thinking about becoming more aware of what their triggers are in the environment that's affecting them. And then there's a screening process, and that is meant to identify if a person has this, how severe it is. It's on the continuum of slight to severe. It's on the spectrum. And then at the end of the assessment, which is a visual assessment of specific pictures and very specific questions that we ask them about the pictures, at the end of that, we use colored sheets that are color overlays that are actually coated with the filter process to calm down their symptoms and their distortions and their physical symptoms. And then we know that the next step for them, if they prefer the overlay over the white page, is testing for Irlen spectral filters, which is my expertise. And we have a lens kit of about 100 different densities of color. And it's a trial and error basis with the filters that you saw April holding up. And we like people to have a current eye exam so that their world is clear. And then with the filters, we've got the stability and the comfort. The symptoms are reduced. And these are worn as glasses. Now, this person in the picture, you can see they have some type of a pinkish, reddish pair of lenses on. But when they look through them, their world is normal. It's not tinted this color, because those colors are the ones that person needs to normalize the wavelengths of light that are causing their symptoms and distortions. But when you look at a person, you will see color on their face. But when they look through the lens, they do not see that color. They see the world normal, and they see colors as they should be. But they're not experiencing the symptoms and distortions anymore, as long as they're on their face. So it's a treatment. Additional accommodations and modifications, we talk to them about possibly color paper if they do a lot of writing, or have forms they have to fill out, making copies on those. Lighting in the area, their work environment or their school environment, wherever they are. The goal is to get the filters on their face, because that takes care of everything, and these extra accommodations, for the most part, are not necessary. So the color overlays are on the right. There's 10 different colors, and you can layer them up as well. A lot of people need more than one color to take care of everything. As long as they're looking at those overlays, their symptoms, if they have this and if this is a treatment that works for their brain, will go away. They look up, they're back to ground zero. So that's why the filters are the best bet, because everywhere they look, they've got the comfort, and the visual distortions are gone. So what are the results? We have a case study of a TBI military pilot study that we did at Camp Pendleton down in California. We had 178 Marines that were medically resistant to headaches and migraines as a result of combat-related brain or head trauma. And we fitted them with Irlen filters. So as a result, these are the treatments that these 178 military personnel had tried. Sunglasses, 100%, all of them wore sunglasses. 78% of them took migraine medication. They tried alpha stem, acupuncture. You can read this, yoga, different prescriptions for glasses, chiropractor, healing, massage, Botox injections, occupational therapy. All of these treatments these people tried. So as a result, after 4 months, before they had their filters, they were using 22, or they had 22 migraines pre, and then less than 1 post. Medication use went from the prescription drugs went from 68 down to 14, and then over-the-counter drugs 33 to less than 1. So quite dramatic drop in prescription use. So physical symptoms such as light sensitivity, the pre is the pink. So those are the what they experienced. It's quite high. Migraines, headaches, fatigue, agitation, short-term memory loss, poor concentration, behavior, anger control, anxiety, fidgetiness, dizziness, nausea. And the purple is the post, the reduction as a result of wearing the filters after 4 months. And these are specific activities that were causing them difficulty. The pre is the pink again, and the post is the purple. So reading was up there, sleep problems was a big issue. So with an Irlen brain, the Irlen brain goes up and stays up. So when a person goes to bed at night, they're kind of at their peak and their brain never fully relaxes. And then they start out the next day, they might be at a level 3 or 4 starting out the next day and then go up to 7 or an 8 and then back 3 or 4, 7, 8. So it never really relaxes. So a lot of people that we work with have sleep problems. General perception, night driving is a big one because of the glare off of the headlights. Job performance is very big for these people as well because they want to re-enter the workforce, but they're unable to go into that setting when they get back from military service. Math, pencil, paper, watching TV, video games, balance, coordination, depth perception. Huge improvement. So this is a SPECT scan by Daniel Amen, the Amen Clinic. And this is the same person's brain on both sets, in both sets of pictures. The one on the left is this person looking at a computer screen without their Irlen filters. And you can see how lit up the brain is and how overstimulated it is. The set of pictures on the right is the same person with their filters on their face. You can see how nice and calm the brain is, and the visual pathways that need to be working are working, and the rest are nice and calm. These are some resources that we like to share. Helen has written 3 separate books about Irlen syndrome. There are 2 websites. IrlenSyndrome.org is the foundation website, and there are parent and teacher toolkits that I highly recommend that people, and you can print those off if you'd like, that I recommend people specifically look into in the syndrome.org website. In the Irlen.com website, which is the mothership website, there's little colored glasses at the top of the page that will turn the background a different color, and I have had people choose those, and they could feel their shoulders droop. You know, they could feel their stomach relax. They could feel their breathing change when they get to certain colors. There's also self-tests. There's 7 of them, I believe. There's a short test, a long test. There's an autism test, a reading test, headache, migraine tests that you can take for free on here as well. There's also a little video of distortions if you scroll down a little bit on the page, and I highly recommend people watch that. Those are visual distortions that people say they see when they read, and that information can help people kind of make a decision. Maybe I do need to get tested for this and find some relief in my life. Okay, this is my contact information. Feel free to email me, call me with any further questions that you might have about Irlen syndrome and the Irlen method. And thank you very much for having me today. So this little activity has to do with if you want to experience how an Irlen person feels, you can stand up, turn around 3 times, sit back down and find something to read, and blink very quickly at the same time while you're reading. That'll give you a little taste of how a person with Irlen syndrome feels and their inability to access the information on the page, because now they're spinning, they're kind of dizzy and thrown off a little bit. and their ability does not match their performance. Well, thank you very much for allowing me to speak about this today, and I look forward to hopefully hearing from you in the near future. And now I'll turn it over to Lucia.
Thank you very much, Terry. Change our Now we're going to switch over to Irlen syndrome, what OTs need to know through the OT lens. Thank you for bearing with my technological expertise that are an ongoing learning curve for me. Thank you. I've been an occupational therapist for over 31 years now. As you can read here, I've worked with many different patient groups in different clinical and community settings. I've been an Irlen screener for 6 years. I want to share with you what sparked my curiosity about becoming an Irlen screener. Several years ago, I was doing a continuing education class on primitive reflexes, and Irlen syndrome was mentioned very briefly in that presentation, which sparked my curiosity as to what it was. I'm always looking for ways to enhance my therapeutic toolbox to support the people I work with to make them more functional, eliminate symptoms and that. My current area of specialty is mostly pediatrics, aside from doing Irlen screening for all ages. And it has been very instrumental in my toolbox to work with especially autistic children, children with sensory processing disorder, and I'll go into that and you'll hear more in the case studies. I work part-time currently at the Center for Therapeutic Intervention on Bainbridge Island, and I also own my own consulting practice out of Polsbo, but serve the North Kitsap area. The learning objectives I have from the OT perspective is to understand Irlen within the sensory processing framework as a visual system contributing to sensory overload. Then also knowing how this may present in different diagnostic groups, students, or even in our own colleagues. Then I also want to share tools to use if you suspect Irlen, how to implement modifications in a classroom or clinic setting, and understand the process if you too would like to become an Irlen screener. Looking at Irlen as a process of visual processing from the bigger picture of sensory processing, we know we have 8 senses. I like this picture of a house. I use this a lot when explaining to parents of children I work with and some children who later elementary, middle school and up, to help them understand how the foundation, if we think of sensory processing from a house perspective, forms the foundation upon which other skills are built. We know that Irlen syndrome is a brain-based visual processing condition. And for some people, here the little block of vision is, the body position one is the largest one. For some people, how their brain processes visual information might be the biggest block that's causing symptoms and dysregulation. So it's really important to be aware of. Visual sensory overload, what can it look like? Well, shielding one's eyes from certain lights. Some children, whether they're able to, if they're not able to articulate it, might actually, sit under a table or run away from certain environments that might be very bright. These pictures here, show the person holding the boy on the left, holding his head, visual strain, headaches, and that sort of thing. The picture on the right, I think, is important. We know from articulate autistic adults that when they're on sensory overload, if they're on visual overload, oftentimes they can't hear things properly either. Or if it's a very overstimulating, loud environment, then they can't see things clearly either. And that's really important to know that it's not, we don't see each system in a silo. We can analyze it individually, but we need to look at this as a collective whole systemic approach. The functional impact of sensory overload. Here's a list of different things. What we typically see in OT clinics with individuals with sensory processing challenges and anxiety is increased reactivity. They might respond with the fight, flight, freeze, being aggressive, running away, that sort of thing, and difficulty focusing, and then crying. And then let's think about the functional impact of that on sleep. As Terry said, when you've got an Irlen brain, you're on sensory overload, and it's very difficult for that brain to downshift into a restorative sleep-like state. So yes, it impacts sleep, and we know sleep impacts self-regulation, and it's a ripple effect there. We know also that on sensory overload can impact a person's function in their ADLs, their activities of daily living. And that can include at home, going grocery shopping, going to work, and all of that. This is a portion of a sensory checklist by Greg Santucci. He's got a wonderful website with some downloadable resources. Here, looking at the visual system is one of the ones, looking at, is it too bright, too dark? So this could give one some red flags or a clue into maybe this person does have some challenges with the visual system contributing towards their sensory overload. We also know that when one is on sensory overload, it does impact one's feeling of safety. When we look at anxiety, and that trickles over into a sense of physiological stress, which can be experienced by headaches, muscle tension, and things like that. I bring in the topic here of safety because there's more and more work being done on trauma, sensory processing, sensory overwhelm, and trauma, and that these are all interlinked concepts. And so it's something to be aware of as well. And that's a whole other, of course, subject matter that could have complete courses on itself. So within an OT framework, what are the red flag symptoms that one would observe? When we work with autistic individuals or individuals with sensory processing challenges, we frequently use sensory-based questionnaires, the Sensory Profile 2, Sensory Processing Measure, and such like. And it gets information, it collects information on how the person functions in various different sensory domains. So from an Irlen perspective, looking at the visual domain, if they're checking off sensitive under bright lights, does behavior change under different lighting conditions? And I haven't memorized exactly all the specific visual questions under there, but those, if they're correlating with some of the Irlen symptoms, that would be a red flag. And when one's working with children, seeing if their behavior changes or their regulation changes, I should say more accurately, if one's in different lighting settings. I know for myself, we have a clinic with very large windows to let in a lot of natural light, which is wonderful. There are also some fluorescent lights on the ceiling, which we keep off a lot of the time, but it is really interesting if one has a dysregulated child to turn off the lights and see what difference there is in their ability, well, the ability to self-regulate. Then talking here about visual perceptual standardized assessments. A great case in point is I was working with this little autistic boy who was coming up to kindergarten and wanted to do some visual perceptual testing. I'd had an inkling that he did have some visual light sensitivity, and I was doing a motor-free visual perceptual test. And this little boy could not visually attend to this. Thankfully, due to my knowledge about Irlen, I pulled out some overlays and put one on top of it's the one with the visual closure, figure ground, and all of that. And you have to pick the answer. Using the overlays, he was able to complete the entire battery. We heard from Terry as well that black ink on white paper is the most offensive if you have this condition. So if I had not known about Irlen, I would have just put on written up for this boy's assessment that standardized testing wasn't possible. However, using the overlays, he was able to do the entire test of the non-motor portion. And when it came to the pencil paper portion in the little booklet, I copied it onto light blue paper, and this little boy was able to do the testing. Of course, in an OT setting, whenever one deviates from the standardized assessment protocol, it needs to be noted in the write-up, which is what I do. In a school setting, Terry's alluded to a lot of this, reading difficulties and that gap in performance and ability. It's also important to look at this, that if a child is avoiding looking at a page, reading at school, it might not be inattentive ADHD. This is where the diagnoses can be misinterpreted. That child might indeed have a difficulty just visually being able to focus at the black print on white paper. Headaches and eye strain reported in different aspects of a job. I had one, actually a parent of a child of an autistic individual I work with, who ended up getting screened and getting filters, was sharing how when she had a job in her early 20s working in a pharmacy, she actually took breaks to go and throw up. And that shows you, excuse me, the extent of, the stress and the nausea that this can cause. And at that time, she didn't know anything about Irlen syndrome. And that's just something she accepted she had to do at her work every day. And TBI concussions, oftentimes one's aware of, if the sports concussion or concussion from any source, that yes, the brain is hypersensitive to sound, to sight, certainly something to be aware of as part of that rehab process. And then work hardening. I haven't been in an industrial rehab setting for a long, long time, but I do know that factories and things often are lit by fluorescent lights. So if one is doing work hardening in those conditions, this is something to be aware of, or an office environment, which frequently have fluorescent lights as well. And then what about colleagues? More and more these days, we are attending continuing education segments online, like this one, or doing virtual appointments in that. Are our colleagues complaining of increased headache, eye strain in that with this increased amount of time on virtual platforms or doing computer-based work? Something to be aware of. So in brief, if we know the signs, these are the signs. And if someone's complaining of these signs or you observe some difficulties with this, these are some red flags for which one would further want to look into Irlen. So if we do suspect Irlen, then what? There were some handouts which we will attach to the organizers of this recording, a short version of the questionnaire for some questions, but here's some samples of those questions. Terry alluded to that, asking, when you reach the point that you want to stop reading, how do you feel? And what does the page look like? Again, going back to the website that Terry mentioned as well, the Irlen.com, it has a self-test and various other tests regarding light sensitivity. There's a specific one for autism as well. That's a good one to do. Then this number 3 here, the color light bulb test. This can be good for children, young children, or children who are minimally verbal. Is getting light bulbs, red, blue, green, yellow, and you can, in a lamp, change out the light bulb. And this is preferably done in a room that doesn't have windows, so you can controlling the light in the environment. You can change out the color light bulb and do an activity, say with a young child that you'd regularly do anyway, and see if the child's regulation or engagement in the activity changes at all, given the different color light bulbs. And this is explained more on the website as well, the color light bulb test. So yeah, if we suspect Irlen in minimally verbal individuals, there is an observation checklist as well. Again, behaviors like the fight, flight, freeze behaviors. And are there changes, significant changes in regulation under fluorescent lights or bright lights? Okay. This is a screenshot of the Irlen.com website. Circled in green there is if you want to find a place to refer someone to get an Irlen screening, you click on there and it has actually a global network where you can find someone closest to you to do the screening. The Irlen self-test, there you go. There's one about headaches as well. Clicking on this website is wonderful. Also want to point out across the top that Terry mentioned as well, these different color eyeglasses here, that if you click on those, it will change the background of your screen to that color. And paying attention to how one's body feels with the different colors is pretty telling as well. I'd like to mention a few case studies now to illustrate what we've been talking about. One teenager I was working with was reported as being uncooperative at school. I saw this teenager mostly at home, and she used to keep her curtains drawn and the blinds down most of the time. When I did her screening at her house, she was avoidant, not interested, finding anything else to do. As soon as I pulled out Irlen overlays, because in the screening you have certain images to look at or pictures, and I put the overlays on the image, and there was a complete 180 change in this teenager's regulation and an interest in what I was doing. It was an absolute game changer, and she was able to visually attend, and from observing her behavior, I should say her regulation, she was a minimally verbal autistic teenager, was able to identify what color she was best able to use. And once I pulled out the overlay, she was very interested in the whole process. And as the bottom says, she was able to access schoolwork and started learning math within a week of having these overlays to put on her schoolwork. Okay. Then second over here, this is actually my history. I have a history of a traumatic head injury from quite a while ago, and some complex migraines that ensued a year after that head injury. When I trained to become a certified Irlen screener, I was like, yeah, maybe it helps a bit, but I could take it or leave it. It was the transition to the virtual platform during COVID and the increase in screen time that made me start getting more ocular migraines quite regularly. And this was about third week into the pandemic. So I started using my overlays on my screen to help myself, and then was talking with Terry, okay, I need to get some filters as well. So these glasses I'm wearing are Irlen. They do have Irlen filters on them. I'm actually coming up for a recheck. It's been over a year that I've had these on, and going to have my filters rechecked to reduce symptoms. But since wearing Irlen filters, I didn't have ocular migraines from the screen time. And I can report that from my own perception that one's brain, it's almost like a taut elastic band that just goes, it takes that tension and eye strain and headaches, and in my case, ocular migraines as well. It removes that. Okay. Then I had the mother of an autistic child I was working with. Both mom and child had Irlen syndrome quite severely. The child never wanted to play outside and had to wear full wraparound sunglasses whenever he did. And the mom had this history of several challenges. When she wore her Irlen filters for the first time, she's like, wow, there's my feet. Now, she was a bright woman, knew she had feet, but I think that whole body perception, the spatial piece and the depth perception is huge. She jokingly says, well, I drive a Tesla because it can park itself, because the depth perception with parking a car was impacted with her. And 9 months after wearing her filters, these are her comments. My eyes don't have to ache, less like I'm drowning in the world. And just think of the functional gains as a young mom, in terms of her confidence and just a sense of wellness. It's overall had a huge impact on her functional ability. Then a first grade student. So you can see from the left, if a child, that's one example of a visual distortion. Now, children learning to read don't know that having headaches, stomach aches, etc., when you're learning to read is not normal. And it's interesting, this girl here, she was screened. She's another child I was working with from a sensory processing disorder perspective. And I also had an inkling that she had Irlen syndrome. When she was screened, she had difficulty reading methodically through 6 sentences. After identifying her color overlay, she went home and read a 32-page book. That was one of those rewarding days to celebrate OT and what we can bring to the table, with her mom with her happy tears about this reading. And then on a math test, when using a color piece of paper versus white, the difference in score. So accommodations. In a classroom, one can turn off half the fluorescent lights and have the children with Irlen syndrome near the windows. There are also those colored gel coverings that one can put over fluorescent lights. Having a child or an adult, well, for a classroom, wear a hat with a dark brim to protect them from overhead lighting. And then in testing considerations, as I mentioned, the little boy, being able to use overlays on the visual stimuli or printing the booklets onto a color piece of paper. There are more at irlen.com on classroom accommodations. Okay. So an Irlen screener. As a certified Irlen screener, I can determine if a person has Irlen syndrome, how severe it is, what type of visual distortions they're having, if they're having them, and how many and the types. We also identify the overlay or overlays and the color of paper that can diminish or eliminate their symptoms. There are certain requirements to become an Irlen screener. So you have to have graduate degree in the fields mentioned there, or teaching certificate. And then on the website as well, there's a link where to get trained. In Washington State, Terry is the person to contact. Typically, it's a 2 days, 2 very, very full days of training, after which one then has to screen 5 people and send those case studies into the Irlen Institute. So the takeaway for OTs is, here we go, that this is a challenge with the visual processing system, and it can cause this physiological stress. It's present in clients. It could be present in yourself, like it is in me. So think of this with your autistic sensory processing kids with trauma, head injury, all of that, and what Irlen can look like with anxiety, emotional ability, etc. You've now been enlightened in terms of, if you see Irlen red flags, it's observational checklists for verbal and minimally verbal individuals. You know about the referral process for screening and diagnostic assessment, and the process to become an Irlen screener. So for me as an occupational therapist, this has been a phenomenal tool in my OT toolbox. It's applicable to many clinical situations in the bigger picture for people. It could be an impactful piece of someone's overall puzzle, shall we say, towards overall functioning. And it might be something you're dealing with yourself. And it can certainly individualize our treatment process or our treatment approaches and functional outcomes. It could be used for screening. It's also incredibly cost saving. Think of those people with a head injury, the Marines, and their outcomes and all they tried. And this has been so impactful for them. And for myself, it's also, having been in the field for over 30 years now, it's a wonderful specialty to have. When I also think long-term transitioning out of maybe clinical, the physical work of working with people physically in a clinic, to having a specialty practice exclusively could be in this, on this side. Okay. Down here at the bottom is my contact information. I also welcome people to contact me with questions regarding Irlen syndrome, how it impacts occupational therapy and therapeutic approaches, anything like that. We thank you for attending today and look forward to answering any questions people may have. Yeah, I'm looking how to stop recording. There we go.
I think it's still recording.
It is.